Welcome back to Good Morning West Tennessee. Joining us in studio now as part of our recognition of Heart Awareness Month is Dr. Alex with the Cardiovascular and Vein Center here in North Jackson, here to discuss some of the issues about heart disease and certainly what are some of the signs and symptoms that people need to be aware of, I guess, as they're kind of considering that they may be apt to fall victim to this.
Good morning. The heart attack is a problem because of the blockages in the arteries. It consists of the plaque and a clot on top of it. It can actually close the artery and cease the blood flow to the heart muscle, which causing a damage to the heart muscle. And the symptoms people experience are the chest pain and shortness of breath and profuse sweating. But it's classic symptoms. It also could be other symptoms like lightheadedness, nausea and vomiting, or indigestion. If this happens, please don't delay, call 911.
So you want to kind of stress, get in touch with the emergency personnel if that does happen. But as you're weighing the signs and symptoms, what other things you need to be aware of? Are there certain blockages in areas that can also result in other health issues?
Yes, Brendan. This is normal looking artery, and the arteries everywhere in the body, they bring in blood to the organs, and when the cholesterol builds up in the walls, it creating the narrowing in the arteries, and arteries eventually narrow down so severely or completely close that it ceases the blood flow to the organs. And if it happens in the arteries leading to the brain, it can cause a stroke. If it happens in arteries leading to the kidneys, it can cause kidney failure or high blood pressure. If it happens in arteries leading to the legs, it can cause the loss of the legs. I also wanted to talk about the congestive heart failure symptoms. It's actually reaching epidemic proportions in America, and one of the examples is problems with the valves in the heart. And the valves could be too tight and they're sticky, or leaky valves, and it overloads the heart and develops people congestive heart failure. And then people complain about the shortness of breath and rapid gain of their weight, swelling in the feet, and that's how it looks. The heart becomes very large, and you see in the chest, it occupies most of the chest. And this is a funny picture. You can see people, people sweating and easily get fatigued. You can't step a couple steps. I have to stop and take a breath. And you see a puffing and huffing heart. And this is the heart failure symptoms.
So this is kind of a characterization of kind of what your heart's going through.
Exactly.
And what are some, I guess one of the things that are going to dovetail into next week is, what are some of the things, measures people need to look at in correcting this?
We definitely can help with the preventive measures and changing the lifestyle, the diet, but we'll talk a little bit more next week about these measures.
All right, well, we're going to keep you coming back every Tuesday here to talk about Heart Awareness Month. Dr. Alex from the Cardiovascular and Vein Center coming up. But Dr. Alex, thank you for coming in this morning.
Thank you for having me.
All right, see you next week, and we'll see you coming up after the commercial break. Mike McAvoy will give us a final update on the weather.